Good evening, everyone. It is Fertility Talk. It's Wednesday evening, 8 o'clock. So this month we are doing a talk on PCOS. Just to make sure my sound is perfect, everything is perfect. Okay, so thank you everyone for joining us. Just gonna give it a few minutes if you want to get the notification. So thanks, guys. Okay, so tonight on Fertility Talk, we are talking about how does PCOS affect my body. And tonight's guest, we have Dr. Pottow, Dr. Joanne Pottow, and she is the new fertility specialist at Cape Fertility Clinic. So this will be the first time she is going to be talking on Fertility Talk. If any of you that is just joined us, this month we are talking PCOS. That's all we're talking about this month. If you have any questions, if you are suffering from PCOS and you have any questions for the doctor, please put it in the comment section. If she cannot answer at the time and she, if you run out of time or anything like that, she will obviously respond after the talk. So please just put the comment, add your questions in the comment section. So I'm just going to invite Doctor now. Dr. Pottow, there we go. And then wait for it to come on board. There we go. That was quick. Hi, Doctor. How are you?
Fine, and you? Hi, Leanne.
Good, thank you. Hi. Nice of you to join us. And it was very, very quick. I was so busy waiting for it to load. So thank you for joining us on Fertility Talk tonight. It's the first time you're doing Fertility Talk with us.
Yes, thank you for the invitation.
It's a pleasure. So you are the new fertility specialist at Cape Fertility Clinic.
Yes.
And please take the time to introduce yourself, tell us where you're from, what you do, so the guests kind of get to know who you are.
Okay, well, good evening, everyone. And it's so lovely to be able to have the opportunity to talk to you all. My name is Dr. Pottow. I was in Gauteng, and I have recently moved down to Cape Town and have joined the wonderful team at Cape Fertility. So I am new to Cape Fertility, but certainly not new to reproductive medicine, so reproductive health. And that's me in a nutshell. Yes, so you will find me there.
Awesome. So tonight's topic, as I said, it's PCOS Awareness Month, and we're just talking everything PCOS at the moment. And there's quite a few women that actually suffer from PCOS, or some women that actually don't know they suffer from PCOS. For my talks last year, I kept saying, as I started doing the talks with these different doctors, I started realizing that when I walk past someone in the street, or see someone at the shops, or I'm like, oh, she's got all the symptoms, and I wonder if she knows that she could be suffering from PCOS. So it's a topic that has to be discussed for that reason, that these women are suffering and basically suffering in silence. And we try and raise awareness around PCOS, and that there is hope and there is things that we can do for it. So what the first question we're going to go into is, what is PCOS?
Okay, so PCOS is polycystic ovary syndrome, and it's a bit unfair that it's named after the ovary, because it certainly is not confined to the ovary. It's going to affect you head to toe. And I think that's exactly what you were saying, is that a lot of women are walking around without knowing, because we've normalized having a very long period. They'll say, oh, I often skip my periods. I don't have a period every month. I'm exactly like my mother. We used to have one every 3 months. Now that's not normal. And we've normalized it. So that's a slight, one of the symptoms, having bad skin, having, oh, my mom's very hairy. So, I've just waxed and I've just learned how to laser. But actually that's not normal. It can be. But the thing is, when you put it all together, actually a lot of women are walking around with PCOS. So ultimately, they say it's the most common endocrine disorder. It affects between 4 and 12% of women of reproductive age. So it's a large percentage of women that are walking around with PCOS that may or may not know.
Yeah.
I also think it doesn't read a textbook. There's not, yes, you can see there's some people that have all the classic features, and we'll go through those. But there are also some that don't. They
Yeah.
are what we call a skinny PCOS. So we always expect a lady who has PCOS to struggle with her weight. But sometimes you can actually be underweight and still have PCOS. So it doesn't prescribe to one particular gene, like phenotype, or what you're going to look like. But I think that's what it goes into with how do we diagnose it. And it's quite simple in that we have these criteria. They're called the Rotterdam criteria. And there are three things that we're looking for. One, your ovulatory cycle, so your menstrual cycle. Is it too long? And we can go into what is too long or what is too short. So we want to know, do you have an abnormal ovulatory cycle? Two, we want to know, do you have any features of hyperandrogenism? Now, that's just a very big word for a lot of male hormone. So do you have hair growth? Do you have oily skin? Have you started losing your hair? Those are all features of clinical features of hyperandrogenism. But biochemical is ones that you'll see in the blood. So some women have perfect skin, they have got no hair loss, and yet biochemically on their blood tests, it shows that they've got higher levels of male hormone. And then lastly, it involves the ultrasound. And this is where the ovary comes into play. It has a very specific look on the ultrasound. And we have criteria that a gynecologist, and more specifically a reproductive medicine specialist, would be able to scan and tell you, do you have those features? And if you've got two of those three things, that's how we make the diagnosis of PCOS. And that's ultimately, but what somebody would experience, and what we typically hear is, I have a very abnormal period. It's very long, or it's very short, or I only have a few a year. I really struggle with my skin. I've started to notice I'm losing hair. And another big one, I struggle with my weight. It's so difficult to keep the weight off. I go on diet with all my friends. They lose a kg, I lose 0.1, and we've been equally as good. And those are the things you hear and see.
Okay. So you've actually gone through three of the questions, which is perfect. And then, so the next question is, how does PCOS affect my body? I don't know if we kind of touched on that now, but if we could go through that.
No, I think, you know, the big thing for me with PCOS, I want to demythify it. I want to separate it into two nice sections. There's one, head to toe. It's going to affect you head to toe. And then it's going to affect your fertility. So it's about where you're at. It doesn't read a textbook. Like I said to you, there's some women who can be diagnosed with PCOS. And ironically, they were lucky. They didn't have ovulatory issues and they've managed to conceive. But they've got the other things we're talking about, the head to toe story. So what we know is that you've got this chronic abnormal hormonal imbalance in the body. And that leads to what we know is what we call the metabolic syndrome. You have a high chance of developing diabetes. You have a high chance of having high cholesterol and weight issues. Now, the thing is, that's going to happen for every woman, or you are at high risk of developing those issues. And that's why, from a medical point of view, it's so important for us to follow up and manage women with PCOS so that they don't have these consequences, because we know where that goes. You have high blood pressure for your whole life, you're at a high risk of stroke. If you've got diabetes from an early age, you're at risk of all those diabetics, heart attack, losing your limbs. It's significant. But can you see that we haven't even started speaking about the ovary, even though this disorder is called PCOS.
Yeah.
So it affects your body head to toe. Your mental state has a very big thing. There's a high association with depression, and also then your higher risk of endometrial cancer. So when people think PCOS, we always think, ooh, infertility, but it extends so much more than that. And that is the reason why we want to control all your hormone levels. It's not only for fertility purposes. It's to make sure that you don't land up as one of those candidates high risk for a heart attack, a stroke, and that type of thing later on, and cancer.
Yeah. Would someone dealing with PCOS, would you say they need to visit a gynae on a regular basis because of this? Or just your normal, if they're not looking at the fertility side of things, or should they just visit their family practitioner?
So I think once the diagnosis has been made, I think that's where the difficulty comes in. It goes amiss, and we're not sure, we're not screening. If you know somebody has come in with the diagnosis of PCOS, you're going to be quite particular with screening of their weight, screening of their cholesterol levels, also keeping an eye on their blood pressure. These are the women that are at high risk of developing these chronic disorders and diseases, and we're trying to prevent that. That's what we're ultimately trying to do. But I think, once you've made the diagnosis and once it's under control, by all means, it's not that a general practitioner cannot manage, because hypertension, diabetes, and screening for that is their bread and butter. But I think while you under the while you're still being diagnosed, and making sure that your hormone levels need to be controlled, finding the right oral contraceptive that can help do that for you, that is really the role of the gynecologist. And then, of course, as soon as we get to the reproductive medicine specialist, the fertility comes into it. This is what we see. It's one of the most chronic anovulatory disorders. So we know it causes a lot of frustration with women trying to fall pregnant.
Okay. So the next question is, how does PCOS affect my fertility?
So the biggest thing is we need an egg. So I always say to my patients when I see them, I say, we need three things. We need sperm, we need an egg, and we need a uterus, somewhere for this baby to grow. And with that uterus, we need tubes and where they could have met and made a baby. So it starts with, I need an egg. And if women with PCOS who is not ovulating, we're not getting an egg monthly. So it really starts with getting that woman to ovulate. And there are lots of different methods and different medications that we can use to help that person ovulate.
Okay. There's quite a good question here while we're on that. It's, does metformin help with PCOS, and does it make you fertile?
So I think metformin is a wonderful drug and it does help, but it cannot be used, singularly as people say, oh, well, I'm taking metformin. You need to make lifestyle adjustments and modifications when you are taking metformin. So for example, we know increased exercise, how much? 150 minutes a week. So that's really 30 minutes, 5 times a day, 5 times a week. So if you put on your walking shoes, you don't need a gym contract. You don't need to do anything excessive. You just need 30 minutes a day, 5 times a week. That is a big lifestyle modification. Following a low GI diet. We know, we all think we've got quite a good idea and a grasp of what's a good diet. But if you actually start to analyze what you're eating, we don't follow a low GI diet. So a low glycemic index diet. Now, if you're doing those lifestyle modifications with the metformin, 100% you're going to get the benefit of the drug. But it's certainly not a super drug that can fix everything on its own, if that makes sense.
But so it's not going to actually make you fertile. It's that with everything else.
100%. This is a combination thing. They have got lots of trials out there where they looked at just putting women on metformin and to see if they would ovulate more frequently. But it's been shown that alone, it's not as effective as if you combine it with lifestyle as well as other medication. So you need sort of the whole concoction.
Yeah. Okay. So what treatment is recommended for anyone with PCOS? I think at Cape Fertility, what treatment would you recommend?
So I think when a patient comes to see us at Cape Fertility, you know, you even if they have the diagnosis of PCOS, we treat couples. There are two people involved in this process of making a baby. And I think that always goes back to the basics of, do we have a normal semen analysis? Because that's one of the three things we need. So do we have sperm, and can it do its job? So it's a quick semen analysis to figure that out. Then two, do we ovulate? That's what we want to figure out. And three, when I said we need an assessment of your tubes and your uterus. So it's more of a holistic approach, that we would make sure that all of those things have been addressed. Yeah. That also that you have the correct diagnosis. Do you have PCOS? And if you do, what are your options? Because there are quite a few different options. It's not just a one size fits all. And the most important thing would be to get you to ovulate.
Okay. I remember with a talk with Dr. Suleiman once, he said that, you know, he likes it when people with PCOS walks in, when it's couples with a lady with PCOS, because it's like the easiest thing to treat. You know, and so it kind of gives us hope for women that's dealing with PCOS, that it's not a life sentence, that you're never going to fall pregnant because you've got PCOS. It's actually quite an easy thing for him to treat.
I think the thing is that, you know, women are born with their eggs. So a PCOS patient has a larger basket. Yeah. More eggs. We cannot manufacture eggs. When some woman walks in and you realize we're out of eggs, that's devastating. When someone comes in with PCOS, we know you have eggs. We just have to get you to ovulate. So if you come to Cape Fertility, we can get you to ovulate, give you that chance of conception. And it's not to minimize it, because I think any woman who's suffering from PCOS is like, oh, you know, you don't understand what I go through. I'm actually depressed and I'm always on diet and it sounds so easy. Eat this, do this, but the weight doesn't come off. I can't get to ovulate. So it's not to minimize it. But I do want to change the narrative. I do want women with PCOS to have hope, because they have every right to have hope that if they want to have a baby, we need to get you to ovulate, and we need to get to make sure everything is tick, tick, tick. We've got the sperm, the tubes are open, you're having intercourse at the right time, and that there is an egg waiting there in the tube for the sperm. And with that recipe, it's only a matter of time before we get it right.
Okay, that's great. What are my chances of conceiving if I have PCOS? Again, you've touched on this a bit, but if you could just answer that.
Yeah. So the thing is, it's a very good chance. It's very difficult to give a percentage to say, well, you've got 40%, because the irony is sometimes we don't only have PCOS. Some women will have PCOS and endometriosis. Some women will have PCOS, so they've got tons of eggs, but their husband have no sperm. And so it's all about it. You have to put it into context. I think the message should be that if you have PCOS, yes, fertility will be maybe a struggle. It might not be as easy as all your friends, as just a quick, easy, natural conception. But if you have to choose a problem, this is the one problem you want, because this is the one where we've got eggs and we've got to get them out, as opposed to another infertility problem.
Yeah. There was another question that just popped up earlier. I just want to see if I can get it. I can't actually scroll back. Oh, there we go. You can scroll back to it. Okay, there we go. She says, I've been diagnosed with PCOS, endometriosis, and fibroid. I've been struggling with extreme lower back pain. Ended up at the ER. My scan showed bulky or enlarged ovaries. Any advice?
So the bulky and enlarged ovaries is the PCOS, where we know you've got this big basket of eggs. We know that's one of the criteria that we diagnose PCOS on, in that you have to have a certain volume to your ovaries. But that pain is not necessarily anywhere coming from the ovary, you know, and sorry, I never got her name, but I would definitely, endometriosis is an enormous source of pain. Fibroids that are in the incorrect area or very large, pushing, causing pressure can cause pain. So she's got multiple, and it's exactly what we were just saying now with trying to give a percentage of your chance of conception. You've got to look at the full picture, because our bodies don't read a textbook. You don't get one thing and then that's it for life. She's got fibroids, she's got endometriosis, and that is most likely causing the pain. The coincidental finding of large ovaries is giving you the diagnosis if she's got other features of PCOS, and that's not necessarily causing the pain. Of course, I'm saying that very broadly. If she had a large ovarian cyst, of course, that could cause pain. But if it was just bulky, big ovaries, well, that's what we see. Big, large baskets of eggs.
Okay. Is there anything, the last question is there anything different at Cape Fertility or the treatment that you give to someone that's trying to conceive with PCOS?
So I think at Cape Fertility, we have that holistic approach and looking at the couple and looking at the workup, because so many patients come in and say, I've been told I'm going to struggle, I've got PCOS, but nobody's looked. I had a patient recently who came to see me, was given Clomid after Clomid after Clomid, and her husband had no sperm. And no one had started there. So I think that's the difference. It's, if you need help, to come where it's more of a holistic approach. We want you to have a baby at Cape Fertility. Come, we're going to have a workup, we're going to make sure and give you options. What's a quick road to fertility or to conception? What's the slow boat to China options? You know, get you to ovulate one egg at a time, and we try that way. We'll give those options to you, and then you as a couple decide what's best for you.
Okay. Do you have any last comments for the women out there that's dealing with PCOS and dealing with infertility?
I want to give them a message of hope, to say this is something that we really can help with. We can. We know it's difficult because, you know, ovaries don't do as we say and they don't listen to us. But eventually we make friends and we get them to ovulate an egg. And that's what we want, and we can do it. There's, like I said earlier, when you don't have any eggs, that's devastating because there's nothing anyone can help with. But this, we can help you with this. Most importantly, we also want you to stay happy and healthy. We want you to have a baby, but we want you to be around when that baby is 30 years old. We don't want you to have a stroke, have diabetes, and have the consequences thereof. So to understand the condition and know how to treat it and also know how to control it is when it will therefore not present any problems going forward for yourself. So come and see us at Cape Fertility. Let us help you. Let us help you get your dream and also live a long, healthy, happy life, and don't worry about PCOS.
Thank you so much. Got a last question is intermittent fasting recommended for someone trying to conceive with PCOS?
I think the thing with diet is that you need a low GI diet because you're trying to control your insulin levels. That's ultimately what you're trying to do. You don't want surges in insulin. You want your insulin to be as stable as possible. Hence, that's why metformin and all these other drugs can help. So your intermittent fasting, you know, I know they've got different, at the moment, different hours of fasting for different age groups and all of that type of stuff. To me, it's not so much about the fasting. It's about the fact that you don't eat a sweet at night or have a bowl of rice, which is going to make, which has got a very high glycemic index, make your sugars soar, make your insulin soar after that. And now we're sitting with a very high insulin level. So the intermittent fasting, if it's making you feel good and it's a diet that works for you, wonderful. I would like it that you do eat within 12 hours, 7 a.m. to 7 p.m. So it's a form of intermittent fasting, but maybe it's not so strict. And then on top of it, eating low GI foods.
Okay, thank you for that. I think the scariest part of this is, so I also suffer from PCOS. And the scariest part of it is always hearing about the diabetes and the high blood pressure, all those type of things. That's the scariest for me. But
Yes.
thank you very much for the talk and taking the time out to talk to the ladies out there. So if anyone has any questions for Dr. Patel, am I saying it correctly? Dr. Patel?
Yes,
Patel.
Potto.
Patel.
Potto, that's fine. Yes.
Dr. Joe Patel, if you have any questions, please feel free to either leave it in the comment or you can actually email her. If you could just leave your email address for everyone.
Sure. It's J Pottow, so JPOTTOW at Cape Fertility .co.za. But if you go to the Cape Fertility website, my details are there. There are also another 4 fantastic doctors, so there are 5 of us there, and we would all be glad to help you in any way we can. And I don't want Julianne to be scared of the diabetes and the hypertension. It doesn't come with PCOS. We have to
Yeah.
get it. So if we control it, you won't have it. And that's the
Okay.
good news.
Thank you very much for that, Doctor. Thanks,
Only
everyone. If you guys have any questions, please put in the comment section, or a couple of minutes time, I will be uploading this to Facebook, YouTube, and you can also watch the video afterwards and also get the details. But you can contact Cape Fertility directly at the Cape Fertility website. Thank you, everyone, and have a great evening. Thanks, Doc.
Thank you. Thanks
Bye.
so much. Bye.
Bye.